Hello, everyone. We welcome you today for this new virtual dialogue that is entitled Rethinking Pink October, How to Increase Engagement with the Public Virtually. So my name is Sabrina Zucchello, and I'm leading the Breast Cancer Program, which is an initiative led by UICC, aiming at strengthening and engaging the breast cancer community globally. And today I will be the moderator of this session, and I'm supported with my colleagues from UICC, Melanie Sampson and Muriel Auclair, whom you will hear from a little bit later. I'd like to start with a few ground rules that I'm sure you've already heard. These are to please mute yourself when you're not talking. It's also to switch on your camera if your connection is good enough so that we can see your face. And also to make the most of the chat box. There are a lot of people who will be attending this session, and we want it to be interactive. So that's the best place for you to put your questions while you hear about the presentations, share comments, but also let us know who you are, your name, your organization, and if you have any breast cancer awareness campaign actually that you are planning with URL, you can share. That will be of interest for everyone here on the call. So about this topic, it's been more than 3 decades now that October is known as the Breast Cancer Awareness Month. And throughout this month, breast cancer groups, they launch communication campaigns and also events to encourage the public in taking action to fight breast cancer. And this can take various forms, for instance, the promotion of early detection, addressing questions around breast cancer stigma. It's also the opportunity to raise funds annually, and in general, educate people on breast health. With the COVID-19 pandemic, a lot of things have been affected, obviously, including Breast Cancer Awareness Month and the way campaigns are conducted. More events needs to go virtual and compete with attention with other groups on the social media. There are also screening programs, usually using October to reach more people with mammogram or different types of people with mammograms that are struggling on respecting the limitations on COVID-19 and at the same time continuing to deliver services. So in this conversation today, we will hear mainly about these 3 questions: how to design campaigns that remain relevant in the pandemic context, how to adapt and deliver screening campaigns in this context, and how to assess the impact of these campaigns to ensure it continues to support the patients in the way it intends to. So today we have the pleasure of having a panel of 4 speakers who will all bring insights from their experience and examples of their work. And we've chosen them from various regions of the world, and also because they represent various types of campaigns, as you will see. So our first speaker is Corinne Ellsworth-Beaumont, CEO of Know Your Lemons. And thanks a lot, Corinne, for being with us today. So Corinne will open the talk by sharing with us the recipes for successful breast cancer awareness campaigns based on the principles of design thinking. We will then hear 3 short case studies from UICC. The first one will be presented by Gabriel Johnson, who is a project coordinator, and who will share with us the virtual campaign that FEMAMA in Brazil will be launching in the coming days. We'll then have Ebele Mbanugo, the executive director of Run for a Cure Nigeria, who will be sharing with us how they have adapted screening and educational activities happening in person in this context. And finally, as a third example of great Breast Cancer Awareness Month campaign, we will hear from Mary Wong, the chairman of the Global Chinese Breast Cancer Organizations Alliance in China. And she will be sharing with us her plans to deliver a hybrid event and even break a world record. After all these presentations, we will have a last part that is actually dedicated to hearing from you, the audience in the call. I know most of you are involved in breast cancer and in this month of October in particular. So we'd be very interested to know your thoughts, the questions and comments that you have for our panels. And we'll also have a few questions for all of us here on the call to discuss. So I will now hand over to Corinne, who will share with us the recipes for successful breast cancer awareness campaigns.
Thank you, Sabrina. Good afternoon, good morning. From my side of the world, I'm joining you today from Salt Lake City, Utah. And I'm very much looking forward to talking to you about a good recipe for breast cancer awareness campaigns. So I'll begin by sharing my screen. And please let me know if the slides don't advance. Is this working?
Yes, we can see the slides all right.
Okay, great. So my PhD is in design thinking, specifically for breast cancer communication in global audiences. And that is my background. I spent 12 years in the UK as part of the studies and work globally through my organization, the Know Your Lemons Foundation. So let's dive right in. So the first step in having a successful breast cancer awareness campaign is to involve your audience as part of developing and creating it through a process called design thinking. So design thinking is a human-centered, design-led approach to identifying and solving problems. And I'm going to share with you my framework and very briefly explain some of the process in creating a design thinking, design-led campaign, and then give you an example of what I developed as part of that process. So I use something called the user design thinking framework. And each of those letters stands for a different step in the process. So the first one is to understand patients using empathy. And you can do this by experiencing what the patients are experiencing, observing them, and doing deep dive interviews as a couple examples of that. In my experience, I lost both of my grandmothers from breast cancer. And when my second grandmother died, when I was at university, that's when I decided I wanted to learn more about breast health. And so I decided to take breast health communication on as a topic for my design degree. And the first thing that I did was I observed patients at a clinic, and I asked them questions about what brought them there today. And I got to learn a lot about what people's motivations were for choosing to come to the doctor to participate in screening. And then I also went through the experience as a patient myself. So I had conversations with doctors, and then I was even able to experience what it was like to receive a mammogram so that I could understood what that felt like. The second step is to understand patients within the systems of support. So it's understanding them in the context. And it's taking a holistic view of a user pathway, understanding the communication touch points along the way, and how that system is designed to help them, or in some cases, hinder them from being able to achieve that goal. The third step is then to establish needs with patients and supporters. And that means working in a multidisciplinary way. And part of establishing needs is not just having discussions with each other, but design thinking says it's important to be interactive, to draw, to write things down, to get all the members of the group participating as part of understanding which problems are important that need to be solved. And then finally, the last step is to realize those solutions, and that's through rapid prototyping and getting iterative feedback. So as soon as you have something made that can communicate the concept, then that's when you start testing it and getting feedback. And then as you receive feedback, then you keep building up the prototype until it becomes more refined. And a general rule of thumb is that if you're not embarrassed to show it, you've waited too late before you've started to get feedback. So don't be afraid to start asking for feedback very early on in the process. So I'm going to give you an example of how I went through this process for the campaign that we use. So the first question is to understand what challenges do breast cancer patients face. That's the U, is understanding the user. So, and it's understanding them on 3 different levels: understanding what they think, understanding what they do, and understanding how they feel. So I'm going to give you one example of feeling, and these are the emotional barriers to people engaging with breast cancer messaging. So some people might be very embarrassed to be talking about breast. This is common in every culture. Some people might be in denial that this is something that will never happen to them, and they will never need to know any information about it. Some people worry that breast cancer will happen to them because of other decisions that they might make in life that are completely unrelated to their health. Others feel like if they're destined to get breast cancer, they will, and there's nothing that they could do about it anyway. So there's no point in learning about the information, because what will happen will happen. People can be afraid, and so they stay away from the information because it's not a topic they're comfortable with. Others have apathy, where they say, oh, it might happen, it might not, but I don't really care. And then the last one might be people feeling overwhelmed or very anxious about the topic, to the point that they just give up in trying to understand it. So with these barriers in mind, it's helpful to think, how can we design with these issues that are there? So this is an example of one of the outcomes of this, which is people thinking cancer is too scary to talk about. So a way that that can be combated is to use a friendly tone of voice and to avoid scare tactics. Because sometimes if someone is afraid of breast cancer or talking about cancer in general, if a scare tactic is used, it will completely turn them off to the information. The other thing that it's helpful is to always follow up with a solution. For example, if you notice something like this, then call this number. That can also combat fear if you give very clear directions of how they can solve a problem if it arises with them. The next one is cognitive. And one of the things that came up with the research is that people cannot or do not want to read about the information. So some ways to overcome that is to reduce the number of words that are used in a campaign, because patients will not read if there's too much text. So you can have something very carefully worded, But as soon as there's a lot of text, the chances of anyone reading those careful words goes down significantly. If all of the useful information is only found through the words, for instance, it's not found through the images, then it makes the information inaccessible to low literacy audiences as well. Also, sometimes people don't read it because they're easily distracted. And so they might start on something and then decide, oh, I'm interested in something else. So we have a very short amount of time to catch someone's attention. The physical finding is that not everybody knows how to self-exam. So as you're thinking about how do we teach a new skill, ask who should be teaching this, where should it be learned, and when should they know this? So that's just some analysis of understanding users on those 3 different levels. So the second part is to look at the system and understand what influences are involved in the system. I'm just going to do a very light overview of how to do a systemic analysis today. But it's understanding the people involved in the system, what objects or tools are being used, what laws are deciding how things are done, and the skills that are involved. So I'm going to do an example just looking at laws. So there are 2 types of laws in a system. One is human laws. So for example, don't show breasts, that could be an actual law, or it could be a cultural thing where it's not acceptable. There are also laws or recommendations to say we recommend that women get a mammogram every so many years, or a political policy to say we don't want you to use the term self-exam. Natural laws would be cancer risk increases with age, breasts respond to breast cycles, and there's only 24 hours in a day. So it means that we are limited in when we can interact, because we have to sleep and we have to eat and we have to do lots of things. So it means that we have limits on how much the system can be used. So here's an example of a law that can be discovered by looking at it through a systems approach, which is don't show breasts. So then you think about what are ways that we can get around this taboo. So there are three options. One is to be more abstract than detailed. So maybe it's a very kind of abstract image of a breast. In that way, it means that we lose information because we're trying to be more conceptual than detailed. Use a visual metaphor that everyone can relate to, or rely on using the pink ribbon to communicate the topic and then follow up with more information later.
I would just would like you to see if we can wrap up a little bit, because
yes, of course. Thank you.
Also
So
wanted to add that we'll be pleased if you agree that we share the whole slide deck with the participants afterwards.
Yes, absolutely.
Thank you.
Okay, well, let me skip to the next part. Okay, so this is just an example of how we've overcome some of these things with our campaign. So we use this metaphor of the lemons to represent the breast so we can overcome censorship issues. It's useful because there's no ethnicity with lemons, there's no gender, and because there is no body, there is no taboo. It also helps us explain how a lump feels without having to use any words. And it also resembles the anatomy of a breast. And then this is how we explain breast anatomy to make it easier to understand what women are feeling during a self-exam. And in 60 seconds, we're able to show the 12 symptoms of breast cancer. And we have been able to adapt this for other audiences in other parts of the world. So this is an example of a campaign in Africa where lemons are green. We also have green lemons in Brazil, and then we adjust the language. And when you're able to use visuals, it can get more attention and more reach, and it becomes more accessible to audiences that might not be literate or interested. And then just a few examples of ways to integrate a campaign into your communities. So the first one is to think about ways that you can teach about breast health in school. The reason for that being is that when we don't talk about breast health in school, we send the message that there's nothing to know about this body part that's useful. And so women then don't learn about breast health later on in life, which makes an impact. The other thing that helps with this is that if we teach breast health in school with the assignment to take this information home to your family and start the conversation, then we educate the generations above as well. And it's more likely that we listen to family members than maybe a stranger who's talking to us about breast health. And then by making it a family conversation, it makes it easier to support each other to say, you know, Grandma, did you get screened this year? The second one is to agree that it's okay to say self-exam. Sometimes we confuse patients when we try to get around this word of self-exam. Patients know what self-exam is, they don't know what breast awareness is. And then finally, educate community health workers and HCPs on symptoms, risk, and assessing symptoms correctly. And then finally, after you build your campaign, scale it, share it, and report it with others. And then we work with our charity partners where they can use all of our tools. And I'd be happy to talk to any of you about this, and feel free to email me. Thank you very much.
Thank you so much, Corinne, and I hope we can get back to your campaign at the end in the Q&A. And I really encourage everyone to go and visit the site of Know Your Lemon, because I think you did such an amazing job in serving breast cancer groups around the world with sharing materials and also trainings, and so much ongoing activities for every groups to take part. So really, it's worth to go and visit the website. The next speaker who will present us with the first case study is Gabriel Johnson from FEMAMA in Brazil. So Gabriel, it's over to you.
Thank you, Sabrina. Congratulations, Corinne, for introduced to us to Know Your Lemon. Actually, already saw this in Brazil a while ago, and it was just beautiful. Thank you. Good morning, everyone. At least good morning here in Brazil. I'm Gabriel Johnson. I'm Projects Institutional Relations Coordinator at FEMAMA here in Brazil. We are in Porto Alegre, in South Brazil. So in 2020, we created and disseminated 3 questions that should be asked to those we love and care about, which were: have you been observing your breasts? Have you scheduled your annual exams? And do you know your risk factors? And we did a huge success on the campaign. Our numbers were great. Almost 2 million people were exposed on Facebook and 1 million on Instagram. We also had 2 million likes on TikTok, launching the content to a whole new audience, a younger audience. So FEMAMA also had two press releases with a total audience reach of almost half the Brazilian population, which is 118 million people, and a good press coverage. It was a really huge success for us, at least. It was the best Pink October in 15 years. So then came, of course, COVID-19, the pandemic, and turned our lives upside down. And but however, the pandemic delivered numbers and made Brazilian people pay more attention to the data and the statistics, because every day on the news, we had the number of deaths, number of vaccinated people, number of new cases on COVID. So everyone know your numbers nowadays. So this, and of course, breast cancer also has big numbers too large to ignore, here in Brazil at least. In addition, not to having a mammogram, hundreds of women had their exams, surgeries, treatment canceled or postponed without a date. So this caused a delayed diagnosis and made the disease progress even more, because right now Brazil is facing an epidemic of advanced breast cases after COVID-19 passes, if it will. So in 2021, FEMAMA wants to show the strength, the real strength of the data, because we want to this year to women to come to look for health services again and have a mammogram or the other exams. Here in Brazil, we have all for free in the public health system. All they have to do is to go to the UBS. We say here how can I say this, the health service that nearby your home. So also this year we want to ask 3 different questions from last year. Have you had your mammogram this year? Have you been controlling your weight? Do you have been having a physical activity regularly? Because we now know that risk factors. So we are preparing also with the digital campaign. We are also preparing some offline impact actions in 4 Brazilian cities, 4 Brazilian cities, sorry, São Paulo, Rio, Fortaleza, and Porto Alegre. So one in South, the other 2 in Southeast, and the other one is in Northeast Brazil. So in the whole month. So in addition to that, we are preparing at least 4 public hearings in the National Congress as well, so we can discuss the topics and the fights of FEMAMAs in a political turbulent time, because right now we are suffering for a lot of different crises, not only the health crisis, but political, institutional relations, and everything. So we are politically, we are in a turbulent time. So this year we want to show these 3 questions to the audience, and so they can see to yourselves and ask to other people that they love to ask for the risk factors if they're controlling it and if they're searching for the exams. So this is what we were facing right now. This is what we are preparing for. Actually, the campaign, Sabrina, is launching today. We had a congress, a panel in a big congress today at 4 p.m. Brazil time. So we are launching the campaign there. So you're seeing firsthand here. So that's it for me. Thank you, everyone. And Abel, the floor is now all yours.
All right. Thank you, Gabriel. Fantastic campaign. Definitely look to see how we can incorporate something like that in our region. So we are doing breast cancer screening. Now, I'm sure all of you have been affected by this pandemic as far as being able to have, that one-on-one interaction that, a lot of us in developing nations really need in order to get our point across. And so we have decided, looking at our environment and seeing how things have progressed regarding the safety measures from COVID-19, we've decided that during the month of October, we are going to relaunch our community outreach screening campaign called the Big Pink Fight. Now, the Big Pink Fight was born in 2020, right before the pandemic kind of shut everything down. And we traveled to the 6 geopolitical zones of Nigeria and provided free breast cancer screenings for over 3,000 women. We had the privilege of entering into communities and speaking with indigenous leaders and really getting a lot of conversation started around breast health and just general health for women in our society. However, with the pandemic, this was supposed to be an annual event, but with the pandemic, we had to suspend it this February simply because we wanted to make sure that we were not contributing to the ever-growing numbers of COVID patients. Now that we have a better handle on the pandemic and we're better prepared regarding being safe, we've decided to get back out in October. Now, unlike the first Big Pink Fight community outreach, we are going to keep it to one location, sort of pilot it and see how it goes. And then when we're more confident, open it up to the other geopolitical zones that we cater to in 2020. Now, in order to do this, we've had to sit down as a team and, follow the guidelines set before us by the Communicable Disease Foundation here in Nigeria. And essentially, what we are doing to kind of mitigate any spread, while at the same time providing women with this life-saving exercise, because as we all know, cancer is not going to wait because of a pandemic. So what we are doing differently with our screening outreach campaign is, number one, we're requiring appointments. Before, we would essentially set up these makeshift clinics in rural areas around Nigeria, and people would come at their leisure. And what that afforded us was, huge crowds to really educate and speak with. But with the pandemic, obviously, it's not safe to have large amounts of people congregate, even if we're going to be outside. So in order to reduce the amount of people that we have in our makeshift clinics, we're requiring that each person go online and register and get an appointment time. And then in order to keep our healthcare professionals that help us to do the screening outreaches, the ultrasounds, and then triage patients to get their mammograms, we have to provide them with the necessary PPE and make sure that we have more than enough available for our healthcare professionals and our volunteers. And because we will not have the opportunity to congregate in large masses, we are going to extend the days of our screenings. Generally speaking, our screenings are done over 2 days. And in those 2 days, we can see close to 1,000 patients. That being said, with trying to adhere to the social distancing protocols, we are obviously not going to reach that 1,000 participants in 2 days. However, we are going to extend the days so that we reach as many people as possible. And these are all of the things that we're putting in place so that we can get back out there, because we've had a lot of participants that have come to us last year asking us, when are we going to have our screenings? And, last year, one of the things that we drove home was the necessity of making this an annual or at least a regular occurrence. And so it's a bit disingenuous of us after, promoting regular exams to not provide that service, but we want to do it in the safest way possible. So that's why we put these things in place in order to provide that service to the women that we have essentially, encouraged to come out to be regular about their care. Now, what does that mean for Run for a Cure Africa? What does that mean for our campaign? Well, obviously, we have to be safe, because beyond anything, we don't want to expose anyone to this pandemic, and we don't want to solve one problem to create another. And so we're going to have to be very strict about those social distancing protocols and stick to them stringently. Outside of that, we want to make sure that the healthcare professionals that are volunteering their time and their expertise are kept safe as well. So there really is not a lot of wiggle room in regards to the distancing of people while they're waiting to be seen or to be screened, nor will we compromise on providing the necessary PPE that our healthcare professionals will need. And then just encouraging the participants. And so at the end of the day, it's going to incur extra cost, but it'll all be worth it simply because we are continuing this life-saving exercise, but then we're also keeping the women safe.
Thank
And
you.
we'll also provide PPE to the participants. So real quick, what does success look like? Before we go into this, it's going to look differently for us this year, simply because our numbers will not be the same numbers that we will have, that we had last year. But beyond that, we want to make sure that the people have understood. We want to see those that came last year come back. And so these are all things that we have to define going into the program so that we know that it has been successful and it has been impactful, in our community. So thank you.
Thanks so much, Emily. Now we've heard about the challenges and opportunities of in-person activities and virtual. So now let's go to China and hear about the hybrids in really 5 minutes, so that we can have the conversation afterwards. Thank you, Mary. The floor is yours.
Yes, thank you very much for having me. Well, my name is Mary from the Global Chinese Breast Cancer Organization Alliance. We are actually a platform of all for more than 80 Chinese breast cancer groups. And our purpose is to share and help each other and to enhance our skill in patient support, to advocate and educate in order to eliminate the threat of breast cancer to women. So during this COVID challenge, actually, it presents a lot of, I find that it gives us a lot of opportunity to innovate. Because before that, we were all doing the traditional way, everything is physical gathering and all that. But during this COVID time, somehow we are being immersed into online this organization online things. So the first thing we do for the Pink October is our 8th Global Chinese Breast Cancer Conference. This is a conference which we have done for the last 7 times every 2 years, and it's a gathering of many breast cancer patient groups together to work to share and with workshops on breast cancer care and patient support. But for the first time ever, this conference now in October this month will be hybrid. Why hybrid? Because we find that I know that some of the conference nowadays are virtual, but we find that virtual actually is a bit cold. And if you have a conference the full day, it's very difficult for participants to concentrate. So we decided that with the condition of the pandemic in Hong Kong in a better state, as we have no cases for the last 45 days. So therefore, we have a real presence in Hong Kong for the conference, and we have a virtual for the all international participants. So and this way of making a conference in a hybrid format actually is like making 2 conferences together. One is a virtual and one is a physical presence, because we have speakers who are attending virtually, and we have participants virtually, and then we have speakers physical presence in Hong Kong. So we have to merge both of them. So it's a big challenge, but it's interesting that when we are being forced to do it, we are able to innovate into it. And I think that in the long run, this will become a common sight for us, because we find that it's much easier, because then people, they don't need to travel and they can still participate in the conference. This conference is bilingual, and it is Chinese-English simultaneous translation. So we welcome anyone who would like to join us, because this is one of the biggest conference we have in Asia for breast cancer. And normally we have about 600 participants. So this year we will have about 200 physical presence, and 400 or 500 will be virtual. And well, this is the online registration. We welcome you to join us. And yes, And for this conference, because we are having this conference, we have an idea that we want to make it more bigger, because we saw that because due to the pandemic, many of our patients and carers, they are bound to the house. So actually, people are feeling sad. Actually, there are a lot of emotional problems because we are confined to the house. So we decided that we profit this conference and we make a 1-minute challenge. And this is to get a world record. So we have a sports specialist design a fitness exercise for us, which is specially for breast cancer patients. Actually, it's for cancer patients. And then we put it on a video, and we have put it on YouTube, and we have encouraged everyone who support breast cancer to participate, to join us and film yourselves in one video and send us the video, then to be part of this world record. So actually, before the pandemic, the world record is done like this, that they have the judges come and they will check the number of participants. But because of the pandemic, the judges cannot come. So we have negotiated a deal in which it will be done online, which means we're going to film each participant one video. So one video represents one participant, one entry. So they will count the number of videos, and then they will decide whether we get the world record or not. So this is an online way, which is very innovative and very new to everybody, even to the world record themselves. But they like the idea actually. So the fitness exercise is to so that to remind women to cherish themselves and to know to spread the education, the word about breast cancer, the awareness of breast cancer. And right now we have about 500 something entries. So we still need your support, because we need to have about 1,000 in order to get the world record. So we are working very hard on it, and our deadline is end September, and we hope that we'll be able to get this 1,000 video, and then we can get a world record, so that we can spread the message about the awareness of breast cancer through this campaign. And this is a very new campaign. I think nobody had done it before, and also because it's done online with video, and so it is something very new, which I think that without COVID, we will not be doing this online. You know, we'll be doing physically, and this is something that something good out of the bad, I would say.
Thank you.
Yeah, thank you.
Yeah, that's a wonderful experience. And I think you outlined the opportunities that this crisis is bringing in having to invent new things and breaking world records. So fingers crossed, and we encourage everyone to participate with their teams, colleagues, families, and send you plenty of videos to be able to do the world record.
Hope so. Thank you very much.
So I'd like to turn now to my colleague, Melanie, who will animate this part. We want to know what you will be doing as the audience in the Breast Cancer Awareness Month. We've had some chats and people sharing here, and we would also like to share a poll with you. So you will see a poll coming up on your screen where we will have very simple questions about how your preparations for Breast Cancer Awareness Month are going. What are your main challenges and main opportunities? And whilst you're filling in the poll, Melanie will highlight a few other campaigns for us.
So thank you so much, Sabrina. And thank you. Hopefully we don't have the echo with us. So thank you so much, Sabrina, for giving me the floor. And thank you so much to all speakers that gave like wonderful examples of how we can innovate and how we can like conduct campaigns which are, first of all, person-centered and really making a difference in this context. So I just opened the poll. Please take advantage of this time to fill in the poll. And also, as you can see on the slide, I guess, because I see the poll plus the slide, if you want to share the name of your campaign in the chat box, if you didn't already do so, please take advantage of the chat box to share your campaign. Could be in any language, in Spanish, French, or English. Please do so. We'll keep the recording of the chat, and it will be really useful for us. So during the time of the poll, I would just wanted to, showcase like a number of campaigns here that were sent to me in advance. So really, thank you so much for all of you for organizing such inspiring campaigns. I see CISC, for example, in Indonesia, is organizing a number of events, and also I know that, and I seen like our dear board member Christiana Fonseca, you're organizing so in Portugal, the Pink Wave campaign, where everyone will go pink during a week. So that's very inspirational. And I see Darzor, Association Darzor from Morocco, organizing health literacy events and really sharing information about breast cancer on that time. As usual, a lot of run and walk, the walkathon. So now we have virtual walkathon, and this is like something we saw last year, really with the virtualization of the campaigns, and everyone has his app and this kind of things. And also from Côte d'Ivoire, so there was like a competition of slam going on the radio. So poetry really being like, it's really inspiring, and all we can be agile and having like flexible on how to conduct impactful campaigns. So really through the membership, it's very inspirational. So I hope so. The poll, I will end the poll right now, and I will share the results. Can you can see the results, because I can't see them.
Yes, but I could see them all the time because I'm host. Ask people if they can see other people who are not host.
Okay, no, I can see, thanks to Muriel. So many of you, about 74%, will be organizing campaigns. So please reach out to us and share about your campaign. It's very interesting for us to really know what is impactful for you, and how we can support also your campaigns, and I will Sabrina through the breast cancer program there. And your top challenge is reaching the fundraising targets. All campaigns, and this is something we could also work together to see all virtual campaigns, or could also help fundraising, sharing good experiences of what could be leveraged in order to use virtual campaigns for fundraising. I can see that engaging the audience virtually is also an issue. And in terms of opportunities, I can see it's interesting to see, like, it's a challenge to engage the audience, but it's also an opportunity to reach out to a broader audience. So it's more about quantity than quality. So this is really something that we could reflect about, and also around partnering. So thank you so much for this input. And this is just the beginning of seeing like, oh, we can further support you in this context. Thank you so much.
Thank you so much, Melanie, for sharing that. So I think we have the time just for one question, and I'd like to take the challenge that you both brought about fundraising. It's really an important time of the year for a lot of organizations to raise funds, and we see that this can be a challenge. So I wanted to ask to the panel of speakers, but also to the other people who are attending here, if you have any tips on how to leverage, I don't know, social media, technology, or other ideas that are adapted to the pandemic to still address this challenge to raise funds. So, and you can just unmute and talk directly or raise your hand, and then we will pick.
Well, I think, sorry, it's Mary here. I think, the problem with the pandemic is that we cannot organize big gatherings to get the fundraising. Traditionally we have big gathering of people, get the fundraising campaign. So we need to change it into the virtual means and also try to break it down into smaller campaigns. So I find it that it's much easier when the campaigns are smaller, when it goes virtual, because in virtual you can reach across the board to more people. But if it is smaller, and you must find a way to be easy for people to pay in. For example, using electronic way of paying you rather than sending you a check or, that they have to come to give the donation. You have to make it easy that they can still donate from the house, like PayMe or some virtual means that they can pay from their house, and the money can come to you. This helped us a lot. Actually, we have broken down our fundraising event into, instead of 2 in a year, we broke it down into 4. And then we have many other electronic ways and virtual ways that people can pay from their house, and it's easy to gather the funding like that.
Thanks so much, Mary. That's a wonderful idea. So I see 2 hands raised. So for reasons of time, we'll take both of you and then stop here. So first, Dr. Habibullah will make a short comment, and then I will let Corinne also comment and wrap up the dialogues. Thank you.
Thank you very much for giving me the opportunity. I have joined for the first time in this group. In Bangladesh, our organization is the Community Oncology Center Trust. This is a voluntary non-profit organization, and we are part of Bangladesh Breast Cancer Awareness Forum. And this year, like previous years, we will observe the October as the awareness month, and in Bangladesh, we observe 10th October as Breast Cancer Awareness Day since 2013. And this is a platform, our Breast Cancer Forum is a platform for all organizations working for breast cancer awareness and screening. And this year we have also some virtual meetings and also some in-person campaigns in Bangladesh, in Dhaka, and outside Dhaka. And we Rotary International District 3281 Bangladesh has joined with us, and all the clubs in this district, they will also observe the day with distributing informative flyers and etc. And pink mask, we distribute pink mask for awareness of both COVID and breast cancer. In addition, I have talked to Melanie that a month-long program from October 1 to 31, we have designed a screening program in our center, and also we are supporting this time the underprivileged women by providing free investigations like ultrasonogram, mammogram, FNAC, biopsy, and some other support for treatment. This is our plan, and I will send the proposal to use the logo. EYCC proud member logo also I will send the design by tomorrow. Thank you very much, and greetings from Bangladesh to all of you.
Thank you so much.
Just to share a couple of things that we're doing for October for fundraising. We find that donating on social media works really well for us because particularly when people say, this cause is important to me, please join me. That works really well. We also encourage people to name us as their birthday fundraiser on social media, which is helpful. We've also partnered with companies where they will offer customers an option to add a small donation during the checkout process online. And that has also been helpful. And then this year we're doing a hashtag No12 Give 12. We're asking people to know the 12 signs of breast cancer and then to give $12. So those are some ways of doing it. But we really find that donating on social media where that's available in your country really is the easiest, cheapest, most successful method for us, and it builds community as well. So just to wrap up, there are some wonderful initiatives that are happening for October, and how wonderful is it that we can all come together and share our experiences and what we're doing and see all of these things that are going to be taking place next month that will be benefiting so many women. We're all having to make adjustments because of the pandemic, but that will only strengthen us in the end as we find more tools and ways to reach people and be more effective with the resources that we have. So looking forward to seeing how your campaigns go, and thank you for sharing all the links. That's wonderful.
Thank you so much, Corinne. And we echo this. We're really looking forward to follow all of your campaigns. UICC will also launch a lot of communication activities throughout the months of October focused on breast cancer, including one article that we will publish soon, where we will highlight some of the initiatives that you've shared with us in the chat and in the poll. So that's also why we ask you to share. We want to continue to share your work with the UICC community. So I'm just going to highlight very quickly some engagement opportunities as part of the breast cancer program. On top of communications that will go through our social media and website throughout October, we will have specific sessions on breast cancer as part of the World Cancer Leaders Summit for all our members and leaders in our membership that are invited to attend there, where we will talk about the role of cross-sectoral partnership and innovation to advance progress in breast cancer. So I really invite you to be part of this present. We will also have some fellowships that are available for breast cancer professionals, and you can already apply on our website through that. We've got series of virtual dialogues on breast cancer, and we're just adding one new virtual dialogue today, but the series is expanding throughout the year. And finally, I wanted to announce that there is still one space to join the patient group mentoring program in the EMRO region that UICC has launched at the beginning of the year. So it's really for patient groups to be able to maximize opportunities within a UICC network and get tailored support. So any one of you being or knowing a patient group in this region, please get in touch with us, and would be happy to let you know more about that. So thank you very much for being here today, and we'll follow up with the slides and all of this information that you'll be able to have at hand. And we will see you for our next virtual dialogue in 1 week, the 13th of September, on the topic patient-centered cancer care at every age. Thank you very much. Bye.